Hi, good morning, viewers. So today we have a very renowned cardiac surgeon, Dr. James Thomas, sir. Thank you so much, sir, for giving us this opportunity to have a small interview with you. And before we start, I want you to introduce yourself.
Yeah. I am Dr. James Thomas. I am a professor of cardiac surgery and I am a former Vice Chancellor of the Medical University here in Bombay. And I have 42 years of experience in heart surgery. I have done more than 16,000 heart surgeries and I have set up about 7 heart centers in the country. That includes Delhi 2 centers, Meerut, Gorakhpur, and also D.Y. Patil here, and also there at the Nepal. Nepal, I did the first heart surgery for Nepal, and the king gave me a medal. There's a picture there on that, yeah. And you see king, the
Yeah.
Nepal king, yes. And I did my MBBS from Armed Forces Medical College. I was
That's in
commissioned in
Pune,
1972, Pune.
Okay.
AFMC Pune. I was commissioned in 1972 but I did not join the army. So I went to a mission hospital in Meerut, Sangli, called the Wonders Hospital, which is a 100-year-old mission hospital with a medical college. So I taught there till 12 years. I became professor there. I started MCH cardiac surgery. That's the postdoctoral degree in heart surgery. Then I was in Delhi for 16 years. I set up heart surgery in St. Stephen's, Metro, National Heart Institute. I was there. Then after 22 years, I was asked by D.Y. Patil to come here as the Vice Chancellor. So I came here as the Vice Chancellor and been here for 15 years.
Thank you so much. So you have such an elaborate career and so many achievements to your credit, and it is really an honor that we can ask you few questions जो हमारी जनरल पब्लिक को बहुत हेल्प करेगी. तो सर हम लोग जब स्टडी करते थे तो हार्ट डिजीज़ इन प्रेगनेंसी, मतलब जो औरतों को हार्ट डिजीज़ है वो बहुत कॉमन था. तो अभी आपका एक्सपीरियंस कैसा है?
See, there are heart disease can be divided into 4 groups.
जी.
One is the birth defect.
मतलब जो बचपन से होता है.
Babies can be born with hole in the heart, narrowing in the valves, etc. That's called birth defect.
Okay.
Second is a rheumatic heart disease, which is the valve
Infective.
the valve leak hota hai, narrow hota hai, whatever. Third group is the coronary artery disease, wo blockage hosa hai, heart attack. Then there is something called viral myopathy, cardiomyopathy. So heart मसल का डिसीज का वजह से फुटबॉल जैसा बड़ा हो जाता है. So in pregnancy, the main thing is most of these pregnancies are in 25 later, after that, around that time, so 20s and early 30s, and most of them are affected by rheumatic heart disease because valves are very rarely you may find an ASD or a VSD which was not detected or they did not get operated.
Correct.
So if there's a valve disease and heart disease, we have to be careful. We can do an ECG or an echo. X-rays are usually avoided. We don't want to see that. Yeah, and this sometimes they undergo heart surgery, valve surgery, and then pregnancy comes.
Correct.
In that case, something called acetylene they take, for valve scaling.
Right.
So this acetylene is supposed to be a little fetal. It can harm the fetus, so we have to use it very carefully.
Okay.
First trimester we can give, second trimester like third trimester we avoid giving the acetylene tablet.
Okay.
Then switch them to heparin.
Right, sir.
So most important thing is to detect any problem in mothers. If they have during pregnancy any heart problem or disease, do an ECG also. Sometimes they get a coronary artery, but that's very rare because they are so young.
Right.
And cardiomyopathy. So most probably it is either an old birth defect or a valvular heart disease. And most important is to follow up with the doctor and avoid acetylene in the last trimester, give probably heparin and all that and take care of that thing. And they can go into heart failure also, which may need medicines, etc. So the very important thing is in early women should avoid, when they have a sore throat, neglected sore throat is the cause of the streptococcal infection which leads to rheumatic heart disease and valve disease.
Correct.
So any large sore throat should be covered by antibiotics, and otherwise they get.
So common cough cold in childhood should not be neglected.
If it is prolonged, you should cover with antibiotic, and pediatrician should be shown. So that causes these rheumatic heart disease. And if there is a birth defect, sometimes it's called ASD. There are 4 chambers in the heart. Between the upper two chambers, there may be a hole called AST, atrial septal defect, and the lower one is called VST.
Right.
And this can be closed with a patch. It's a very safe operation.
Okay.
And anytime after 3 years, 4 years, 5 years, these operations are done. So very rarely you get a blue baby. That is, in childhood they can born with blue with 4 defects in the heart, narrowing of the vessel into the lungs. So that also can be correct. So whatever it is, if there's any defect or any problem which is childhood one, that should be corrected. Now, when can you operate in a pregnant lady? Now, second trimester is safe if urgency is required, and first trimester we avoid surgery, and second trimester is safe.
So between 4th month to 7th month is reasonably better. Sir, so our viewers would be interested in knowing what kind of symptoms such ladies have who have either a congenital heart disease which has been missed, or they have a rheumatic heart disease during pregnancy. What problems do they normally present as?
During pregnancy, one of the things is to watch for any unusual breathlessness. When they walk, climb stairs, breathlessness can be one of the things, and you can check for the heart problem.
Right.
Then repeated respiratory infection. They get cough and cold and continuous in there. If there's a hole in the heart because of the excessive shunting to the lungs,
Right.
So that is one. So these are the two: cough, breathlessness. Sometimes they can get even a mild discomfort in the while walking and while exerting. Unusual exertion may hota hai, and usual exertion also sometimes they can get.
So any
breathlessness. Watch for any breathlessness, any discomfort, cough and cold, etc., and loss of weight.
Okay.
Sometimes they lose weight because of the heart disease also.
All right. So it is very important, that if there is because many a times patient
and to get it checked.
Ji sir.
Let one doctor see, so that it's
Right.
heart, and look for a heart sound, and have any murmur. Murmur is an unusual.
So the doctors will do the needful.
Be able to find out whole hair, valve hair, kya hai.
So 2D echo will solve a lot of problems.
Body will show everything.
Yes.
2D echo is a good thing.
And
ECG
2D
also, ECG
correct.
Also.
2D
ECG
echo
will
is
show any lack of blood supply, ischemia or something.
right.
And
Correct.
also ventricular hypertrophy. So, but echo will show. Echocardiography will show any hole, pumping, kam hai, kya hai, what.
Right. Fortunately, in India now, echo is available in interiors also. Very easily it can be detected.
Yes.
Sir, in case somebody misses this and patient progresses in pregnancy, what kind of complications can arise out of a rheumatic heart disease? Or
sometimes, the unusual abortions can happen, if their heart conditions are very advanced or something, and they may not be able to go through pregnancy. So that needs to be watched.
Okay.
And and if they are on acetylene, etc., sometimes unusual bleeding is there, no?
Right.
So that is to be looked for. That's why we shift them to heparin in the last trimester. And during delivery, it has to be done in a proper place, probably not in a small nursing. It should be, the heart disease person should have it in a proper hospital.
where whole team is available.
Yeah, medical backup, cardiology backup.
ICU backup, cardiology and everything.
That is a very important thing.
All right. So you should not plan such deliveries in small nursing homes.
And they should follow with the doctor who is a senior doctor in the institution.
All right. Sir, is it true that the patients who have congenital heart disease, their babies are also born with...
Yeah. I just operated on one 32-year-old girl, lady. She had a hole in the heart.
Okay.
10 years before I had operated on her mother.
Okay.
Her mother, also same hole in the heart.
Okay.
And of course her father had a bypass. So 3 of them, one family. But it was unusual that mother and the mother and the daughter had a same
kind.
Yeah. Sometimes it happens, but not so common, very rare. So if somebody has it, it's good to check the brothers and
the siblings
also.
also.
Family, if there's a hole in the heart or any murmur or something.
Sir, what is your experience with postpartum cardiomyopathy?
Yeah. This is something very perplexing and complex, and why they get it we don't know, and maybe a viral infection or some infection which has caused the muscle, and the muscle starts dilating. Heart is only a pump,
Right.
And the pumping is normally, the left ventricle is the most important, pumping is about 60%. Right. But after cardiomyopathy, it can come to 15 to 20%. So the pumping is not enough. Heart dilates. and then they get swelling, edema, etc. So this is the cause is probably a viral thing, and sometimes they need anti-heart failure drugs, Danoxin, Lasix, etc. Sometimes diuretics to excessive fluid can be taken from the blood, or very rarely some steroids may have to be given for these patients. So we have to watch for postpartum after the delivery if they go into any unusual breathlessness and cough, etc. and take. Then after delivery you can have an X-ray safely and an ECG which can show any of these changes. If it is so, they need to be aggressively treated properly.
Sir, you have such vast experience with valve surgeries. So, if you could just tell our viewers ki what kind of, you must have seen over 40 years a lot of change in the advancements in the valve surgery.
You know, heart has got 4 valves, mitral, tricuspid, aortic and pulmonary.
Right.
So most common valve replaces mitral and aortic sometimes.
Okay.
If they narrow, if they leak, you have to replace it with a valve.
Right.
So the valves which are available to them, one is metallic, the other one is tissue valves.
Okay.
Early when we were in the 80s, when I was in Miraj, I've done a lot of surgery. And also when I was training in Texas Heart Institute in USA, in Houston with Dr. Cooley, one of the top heart surgeons who taught us bypass surgeries. So that time we had a ball and socket valve, so called the Star Edward valve. And it was a ball which will move in a 4 socket, So it will be one way traffic and will come back. Afterwards they started a single leaflet valve, mono leaflet valve called Bioch-Shiley valve. And now we have the 2 leaflets, 2 leaflets which is, so the metallic component is pyrrolate carbon, which is the strongest material other than next to diamond, pyrrolate carbon. And the skirt, and where you can stitch the valve into is called, is from Decron. So skirts, so valves also have skirts, not only the girls. so these skirts can be, so now we have them. This is probably the best valve that we have called the 2 leaflet.
Okay.
So patients take anticoagulants afterwards, the clotting doesn't happen. And by any chance, one leaflet gets stuck, the other can move, they can save, they can be saved. Earlier, if it was one leaflet, they would die immediately, So that's one. Then there's a tissue valve. Earlier we took it from the porcine pericardium, pig pericardium. We make a valve, 3 leaflets are made. Now we have human pericardium, the other pericardium also. So these valves, the advantage is that there is no need of anticoagulation, this acetylene, etc. after 3 months. You keep for 3 months, then you can stop.
Much better.
So this is good probably in pregnant girls, who have a pregnancy time.
Right.
Only issue is that after 10-15 years, 15 to 20 years, the valve will last, it can get calcified. You may have to replace it.
Right.
So the choice is either after 20 years you want to replace it, but safe period of no anticoagulants if they have 2 or 3 children.
Yes, they can tide over that period. Sir, one little word also about balloon mitral valvotomy, because we do a lot of them during pregnancy, second trimester. So it is also kind of a salvaging procedure, right?
Earlier in 80s, we used to do closed mitral valve.
Okay.
On the left side, we open, and then with the dilator we used to die. So that valve is opened and left. And they are good for probably 10 years, 15 years, sometimes it works. So that is one good thing if it's only a mitral stenosis. But nowadays we do what is open mitral valve. You open and then you cut, commissures are cut, the papillary muscles are cut. So the valve is properly opened. You open it from 0.5, 0.6 to 2.2 and you will check immediately for any leaking.
Right.
Here there is no control, if it leaks, it leaks. You cannot do anything. But open heart surgery is called open mitral valvotomy or mitral repair can be done, that is safer in young girls and others, who you avoid anticoagulation.
Sir, just one last question. If somebody is planning to undergo an open mitral valvotomy, how much time does it normally take for a patient to recover completely? Yes.
Surgery takes about 2-3 hours. They are in the ward, in the hospital for 8 days.
All right.
You discharge them, then they come back for a week, after 2 weeks, 1 month. So normally within 2 months, 2 months they are back to full.
Perfect.
People go back to factories to work, once, because the main issue is only the sternum.
So the quality
part is recovered, but the sternum should not move,
Right. So the quality of life must be really becoming much better after these surgeries.
See, newer techniques, the anesthesia is better. We have no issues. Earlier we used to have a lot of anesthesia, lines and all that. Now it is, so technology has improved, you have better valves, your anesthesia has improved, the team is better, post-op care is better, ventilation, post-op is better. Now we have better monitoring systems so that medicines can be given. So results are much better now. And heart surgery, normally 2% or less is the mortality. Out of 100 patients, 1 or 2.
All right.
And
So
if they have
it's
very
become
bad-
much
bad
better,
cases,
much
not
more
because
safe.
of the technique, because they are too bad or something.
Right, right. Sir, before we sign off, I just want you to conclude if you wish to say anything to the general population.
Yeah. I was being interviewed by one of the well-known gynecologists, Dr. Richa, and she asked the right questions, and appreciate the energy and the enthusiasm she has, and I hope this program was useful. She brought in the different areas of which are important in the heart thing. It was nice of her to ask me to speak, and thank you very much, and it was a good opportunity to talk to you all.
Thank you so much,
Thank
sir.
you.
Thanks a lot for this
Bye.
lovely interview. Thanks a lot.